Good idea.
Yeah, your turn to pipe in, Siobhan. Last show you didn't talk at all.
What?
Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Dr. Kolender is going to have a special offer during the show, so please tune in immediately and pay attention to what the offer is. This is your chance. Well, you're listening to News Talk 760 WJR.
Excellent job, AnnMarie.
I didn't do it. You're just making fun of me now?
Yes.
Are you? Did I make, was it a mess? Was it a mess?
It wasn't a mess.
Well, what is the special offer? Is there a
Well, we
hint
gotta
for
wait.
the-
That's a teaser.
I had to say I didn't want to say what the
Okay, that's a
special offer
teaser.
So
was.
we
Okay.
gotta tease for the whole show.
No, but did it really
Okay,
sound
so
bad?
Here we are. We're on Facebook Live.
Right.
Okay, so
Excellent off the cuff. And tell Siobhan how much she did not contribute to the last show.
Yeah, I'm gonna
for
tell her.
coming on.
right, we're going to tell her she sat there and listened intently, but had
she
nothing to
comes
say.
on,
No,
she-
to be fair, though, I mean, a lot of it hinges on my internet. The internet was absolutely atrocious last time.
Really?
None of this. Thanks for coming on. You're
It's atrocious.
getting
today,
out of the
too.
way of the tour. You got to get on stage in a few minutes, and you're doing this in the middle. And
You know what?
she might need some downtime to relax, but no, she's doing this show
We're working.
and didn't talk and didn't do enough
Right.
on the show.
That's right. Got to be.
Well, we already have our first caller, so
Well, we know
Alright.
who that is. So, like, who is it?
Greg and Shelby.
Mr. Positive. Okay. So we have to start. If he wants to weigh in on Roe versus Wade, good.
And we can just start it up a little bit and then bring the caller in. We don't have to eat up the whole segment.
Yeah, that's true. Welcome back, all of you listeners, to our live weekly medical radio show here on 760 WJR. I'm AnnMarie Cronin, and we're back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that number is 800-859-0957. Dr. Kolender, good to see you again. Happy that you're here to give us the updates on what's new in medicine and in the news. What do we need to know this week?
Well, we're going to talk about a few topics today. I think we need to open the air to the government, the Supreme Court defederalizing Roe versus Wade. So we're unhappy to have to talk about that. If people have COVID questions, feel free to ask. And then we're going to talk about just general prevention concepts if we have the time to do that during the show. And of course, we teased an offer, which we'll make somewhere during the show for listeners to get involved in prevention.
Very important offer, actually,
Right.
and it's got to do with one of the very special tests that you do. But so what do we need to know about? What are your thoughts on the Roe versus Wade situation? What is the average patient? And I'm thinking about your patients. That's what it's all about. You know, what do you say to your patients at this time?
Well, I mean, most of my patients are not in reproductive age, but they've got kids.
Right.
And, from my perspective, I don't understand why the government is making medical decisions. The same as why is the government making decisions about what vaccine I should get or what drug I can or cannot take if my doctor wants to prescribe it. It's all in the same pot. Why is my government telling me I can't get an FDA approved procedure if it's right for me is decided between me and my doctor?
Right.
What businesses of the court, what procedure or health care I can or can't do? And now it's a disaster that we've left it up to the states. And, this shouldn't even be a legislated issue. This is an available procedure. And if it's appropriate, the doctor can deliver it. And if it's inappropriate, just like any test, you can't do every imaging test. You can't do every procedure. You've got to have, guidelines that dictate who gets what. This should not be a legislated problem. What makes any given state or government legislature, who are they to make a medical decision? Who'd you vote for? A bunch of ex-businessmen running the state government. Now they're going to decide healthcare issues. They might be smart, but they're not doctors.
Yeah, that's the problem. And the other problem is that the public are consumers, they're buyers of healthcare. It's not being given by the government free. You don't have national healthcare here. So I'm not really sure why the government should be able to step in on a consumer commodity that we buy and pay for dearly on every level. All of healthcare, pharmacy, hospitalization, seeing your doctor, everything is paid for through the nose. So I'm not really sure where they would have any say so whatsoever, because it's not national health care.
And do we have a caller?
Do we have a caller, Siobhan?
Yeah, we do. Yeah, let's jump to the caller. We have Greg and Shelby on the line. Greg, what's your question?
Hey, you guys, Mr. Positive. Dr. Kolender, that was absolutely brilliant. You are spot on, and so is AnnMarie. Yes, the government's got to butt out. Get the heck out. But my question, they talk about the epithelial cells in vasodilators and offsetting heart attack and stroke. What say you on things that arguably can open up the blood vessels, help blood flow more freely, like beets, and there's things in the bodybuilding world, arginine and citrulline, that open up the epithelial cells to make them expand. Do you recommend any of those for people that are having heart issues or stroke issues for that matter?
Well, Greg, thanks for calling. And I still look at a lot of these things as total body opportunities. And so I don't like making specific recommendations because listeners will say, oh, I need to take some nitric oxide, or I need to take arginine, or I need to take this supplement because it does vasodilation. And the reality is, unless you know where you are and what your other drivers are, they may or may not be appropriate. And I don't really recommend supplements that don't have outcomes that I'm looking for. So there may be supplements that are great, they just don't have the data. So nitric oxide is one of these areas that on paper it sounds fantastic, because the goal of an anti-inflammatory approach is to raise your intraarterial nitric oxide levels because they operate as vasodilators. And to no one's surprise, men who take Viagra or Cialis, tadalafil, tend to do better because there's some vasodilatory effect and that the nitric oxide levels are raised. But there's still no outcome data on those, which is what I rely on to make these recommendations. So we still take a much more holistic approach, and unfortunately, those are not things that I specifically advise. Now, it doesn't mean I won't advise them in the future, because that information may be forthcoming. It just isn't today.
Okay, well, right now we've got to take a quick break. Again, you are listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You are listening to 760 WJR.
Well, we may have lost Siobhan.
Well, it might, what threw me off in the first segment was Seffi told me yesterday they're taking the word news talk out. They're not saying news talk 760 anymore. God knows why. There's Siobhan. She's back.
Does that buy us a few more seconds
Yeah.
of
I don't know.
you can say the number twice then?
Yeah. No,
Right.
I
So
don't want to say it at all, but whatever.
So what is it? It's WJR
I
News?
just, no, that's not even. It's just like, it sounds like dumb saying you did to 760 WJR, but whatever.
Oh, but not News Talk.
News talk. It's
Oh.
not news talk anymore.
All right, that's good to know.
Well,
Well, we need to know these things.
yeah, I knew
It's
it.
important. It's very important for us.
Very important. And I forgot to take it out of my copy, and I realized after I said it that, oh my.
Well, I
Anyway,
missed that
so
part. I had to reconnect the service.
was
here
that
is
what happened?
terrible.
It is.
The internet's terrible. I mean, I got the premium internet and it's terrible. So I'm on a hotspot now.
Oh, that's too bad. Unbelievable.
Yeah, I know. All the
So
woes
anyway.
of traveling.
Well,
So-
we can let the Facebook people hear that we're going to be
Right.
offering free CIMTs. So the first handful of callers, and when I mean handful, I mean handful of
Right.
callers, and we may have to take a few more numbers because people may cancel out. They may not be able to make it. So we'll go to the
Next one
you
on
know,
the
the
line.
next ones, the replacements, the backups. So, we'll take a handful of people from each show, some from the Thursday, some from the Sunday show, and we'll be able to do free CIMTs for them.
Mm-hmm.
And so, time and location to be decided.
Mm-hmm. Right.
I'm sure waivers will be involved.
Right. But I mean, it's a good opportunity to get people more interested in the CIMT. We just have to, well, you've had it, Brock. We've all had it. So it's just kind of an easy peasy test.
Yeah, everyone I tell about it would love to get it. A lot of
Yeah.
times they don't know where to go if they're out of the region,
Yeah. And also just explaining that it is non-invasive and nothing to worry about.
No, and we can, again, we'll share that experience when it happens.
Do we have any callers? No. Waiting? No.
No, we had one but it dropped. So
Okay.
nothing
What are we
right
coming
now.
back to? Are we?
Well, let's talk about just the basic prevention concepts.
Okay. And then I think you should talk in the front part about the offer. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, we're always talking about your practice, which is special because you focus on prevention. All of the testing that you do, your whole entire medical practice is solidly about not having the disease, not getting the disease, not having a heart attack, not having a stroke. And you do offer some tests that are not available through other doctors. Tell us a little bit more about what you do in prevention.
Well, I thought we should talk more on Thursday because we go into prevention in quite a lot of detail on Sunday, but we spend so much time on COVID that maybe we're missing, opportunities to educate the listeners in a while on prevention. So, again, listeners are welcome to call if they have questions about their heart disease treatment plan, diagnostic tests that they may have had that are confusing, what they should do for the next step for different things. We're open to, try to help you with get through that, what's going on with you. But the concepts of prevention are really about screening. Our healthcare system is based on waiting for a condition to develop, and then you have a billable diagnosis to do testing with or treatments for. Now we focus on identifying disease before it becomes clinical. And this is the total antithesis to our healthcare system, because if you don't have something, you don't have a billing code. So
Right.
we're identifying the beginnings of a process and aggressively addressing them at wherever you are. So we've talked at length about stress tests being basically useless as a screening tool, and how that if any of you go to your doctor and they feel like a stress test is just part of your routine physical, it's an utter waste of time and money, and it provides false reassurance because it does not identify your risk. In fact, a doctor I used to refer to, back in my traditional days, he tells patients that a stress test gives you 3 years of, safety. It's predictive 3 years out, which is a total.
That's just not true, though.
No, it's a joke.
And in what context is it useful? I mean, is there any context where it might give you some indication of something?
Symptoms. So if you have chest pain, exertional chest pain, meaning you're active, you get chest pain, you stop being active, it goes away, you get short of breath, dizziness, irregular heartbeats, all related to exertion, or even non-exertion, then you should get attention, because those are cardiac related symptoms. Of course, women are known for having atypical cardiac symptoms, but guess what? If you identify your risk earlier and know what your markers are, you identify, what your CIMT measurements are and your inflammation and your other drivers of disease, then you can know that this is or is not cardiac chest pain. How many patients have called me, we've talked about on the show, that they're having chest pain, they want to go to the hospital. I tell them, I already know their profile. This is not your heart.
Right.
Because I already know what their inflammation status is. I know what their CIMT is. I know what they're working on, and that we're moving in the right direction. This is not cardiac. Don't go to the ER. Let's work on what it is. Maybe it's chest wall pain from an injury. Maybe it's acid reflux. Maybe it's stress. So when you know all of these, you can make that assessment. But if you don't, then the fallback position is CYA. We all know what that means. Cover your butt. And the doctor has no option but to tell you to go to the emergency room. Because
Right.
if they don't, they're going to get sued.
I know I had heard from a cardiologist a few years ago who told me there are a lot of women who show up in the emergency room because they think they're in the stages of having a heart attack because they're having symptoms and they don't know what their symptoms belong to. But as you've talked many times on the show, if you get these tests that you do, the CT cardiac calcium scoring test and the CIMT, more importantly, then you know exactly what's going on in their arteries. And so you know that if they have these types of symptoms, it doesn't mean they go to the emergency room.
Right. So what we're going to do for the audience is offer some free CIMTs. So call our number, the 866 Kolender, 866 KOLENDER, and we will be able to do some free CIMTs for a handful of callers during this hour.
So they ought not to miss the opportunity, those people who are listening, if they are worried about the fact that they may have a profile that may lead them to being a cardiac patient, or just anybody.
Or
Right.
not,
Actually,
just
anybody.
anyone. Yeah.
I
Right.
mean,
If you're a regular listener who's not a patient, who's not had a CIMT, you are welcome to call. We'll get your name and number. We're still working out some logistics about where and when, but it's going to be very soon. It's not going to be like in a month. It's going to be very shortly. We're going to be doing this. So go ahead and call, get your name on the list. And if you can make the date and time that we're going to do it, then we'll do it. Yes, I do these at the office, but we're going to have an event around delivering this screening tool.
And also, I mean, Siobhan's obviously had it done. I've had it done. You have lots of patients. It doesn't mean just because you're at a certain age or at a certain risk point for having cardiac disease. We know that you've tested and screened and done the CIMT on many people, your own office included, and found people with very high numbers in their 20s that look healthy, that eat, they're vegan, they eat well, they exercise. So I would encourage the listeners not to think that you have to be at risk for cardiac disease in order to come and get this test.
Well, and call and see if you can get on the list. Just because we're not going to be able to do that many people doesn't mean you shouldn't try to be one of them. And then hopefully you're here with us when we do it.
And I think the other thing that's really important is that there are very few doctors that practice prevention, and even fewer who actually have access to this testing technology and who are able to take a look at what the results of the tests are and then take the patient down the path as to what their next steps are. Because just getting a number doesn't work.
Well, I also think, like you just said, that getting this test and not having someone who knows what to do with it can be useless as well. It's about putting together a program, identifying all the other conditions, whether they're insulin resistance, gut health, hormone imbalance, blood pressure, vitamin deficiencies, all of these things, oral health, sleep health, all these things need to be addressed to have an impact on artery health. And when we're doing it, and the patient and I are good partners in this process, we always see reduction. So I've had patients who you would not expect, who, I'll be honest, who don't look healthy, but they've not lost 1 pound, but they've eliminated their plaque. They went from having plaque to not having plaque, and their IMT measurements went from whatever they were to normal. So it's possible for any of you to do that, and your weight doesn't matter, and your in my opinion, your A1C doesn't matter. None of these numbers make a difference.
So it's possible to reverse the situation and get rid of the plaque. In the meantime, we're going to have to take a quick break. You are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. Back on Facebook. Is next segment
back
4?
on Facebook Live.
Yes, it is.
Wow,
Can I
time
take
flies.
this segment off?
Take what segment?
This one. Like the Facebook segment.
Oh, why?
I'm tired.
Are you? Okay, yeah. Well, Siobhan, so what news
Well,
do you have
was
for
there
us?
anything I was going to ask, was there anything else about Roe v. Wade that you wanted to talk about? I don't know if I missed that in the first segment, but
We could. I mean, it's just a huge embarrassment. I mean, we really spent we spent 4 segments on it, for
Sunday.
Okay.
Sunday. I mean,
For
so
Sunday.
we went into it, in detail, and it's really, I just think it's just embarrassing for this country. It's just a
It is.
disaster.
It's a joke.
Why this is even, all of it, the whole thing is just terrible. So,
well, it looks like we may have had some callers come in, so that might
all right, good.
take
Let's
us on a
go to
journey
that.
anyway.
Right. Let's do that.
So he says he just got 4 at once, so we'll see
Good.
what happens. Just waiting for the names.
4 at once. Wow.
Mm-hmm.
Those are probably people signing up for the CIMT, don't you think?
Oh, maybe. But they would be calling his number.
You would
I
think
don't know
so,
about
but
the
you never
radio.
know because they listen to that 800 number and they just
Right.
dial, smile and dial. So you
Right.
never know.
Well,
we're telling them.
this is 4 opportunities to say our number again.
Right, exactly.
Ashley, you want this one?
What one?
Just to take these? No, call 866 Kolender. Thank you.
That's fine.
Well,
Let
because we
let
don't want
Siobhan.
to take numbers on
No,
this.
no. Let Siobhan do it because
Oh,
she's already in the
No,
middle of
it's
taking it
okay.
down.
Yeah.
Go ahead.
No, I'm just waiting. No, I don't have their names yet. I'm just waiting for the
You
names.
don't have
So
any names?
right. It's
no,
just
he I just
you're 100% right. Mark, if these are radio, can we let the guy know if these are people signing up for the CMT that it's not for the radio?
okay.
Well, you can't. You can just cut them off if they call in, Siobhan, and then that way we'll move
Well,
Oh,
on
he
to the
just
next.
said they dropped.
They all
That's strange.
dropped? All 4?
Maybe they realized they were calling the wrong. Oh, it
I
was all for
Yeah,
don't.
it was all for the service.
Why would they just automatically all have figured that out and all 4 of them dropped?
mob psychology.
That doesn't make sense at all. I mean, they're 4 different people from 4,
It's
different.
866, right? 866 Kolender.
Right.
Yeah, he's giving them the number.
Oh,
Okay.
I see. You're texting. You're in touch with. Is it Blake?
Yeah.
So you're letting him know. Okay. And
All
he's
right, so
letting.
that means we're high
We're
and
on our
dry on
own. We're
callers.
on our own.
It's the
Wow,
Wild
that's
West
not
for
bad though.
segment
That's
4.
all. There's your numbers. You got
Right.
one more and you're done. You're closed.
Right. Well, no, let's not say
If
that.
you well, no, we're not going to say
Collect
that.
some numbers and then so we'll mention it and then let's just keep talking about concepts of prevention.
Mm-hmm. Well, I think you ought to also say that they need to get on the bandwagon because if that many people called, I mean, you just want to say you should call now.
Yeah.
Right. Segment 4.
Yeah, thanks.
Wow.
We're just gonna take Facebook off right now.
Whatever.
I feel like Hoda. Like,
Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, coming back to prevention, and we're obviously getting callers that are calling in for your offer to come and get a free CIMT test, which, again, call 866 Kolender. And Siobhan, you have another call here.
We do. Would you like to start with the caller?
Yeah.
Okay. All right. Let's go to David in Windsor. David, you're on the line. What's your question?
Yes, good evening. It's regarding COVID. What kind of action? I'm trying to suggest to myself what kind of action that I would be looking at taking with regards to, camp and keeping their vaccine mandates. Now, I thought that they were going to be getting rid of all that towards the end of the summer and everything else. And with regards to that, with all the other stuff, and I don't think that I think that COVID, as we all know, is waning. But you're hearing a lot of more people saying that it's going to be back. But I don't think it is. If people are being responsible enough by doing something about it on their own recognizance. Now, what can you suggest about that?
well, thanks for calling, David. The so COVID is not going away. There's strains constantly. So I think it's in Australia right now. The BA.5 strain is going rampant, and that doesn't necessarily mean that it's bad. It's just a cold. And also keep in mind that in other countries they measure cases differently. We're in the United States, the only really way they're measuring cases is by hospitalizations. And who really cares about hospitalizations? Because there's people being hospitalized for something else. They screen them for COVID and it becomes a COVID hospitalization. The bottom line is that deaths are very low. ICU visits are low. This is basically a cold. And I wish, believe me, I wish they would stop messing with this in Canada. I just don't have an answer for you of what you can do there dealing with the government, which is tone deaf.
All right, Siobhan, you have another caller?
Yeah, up next we have Leslie in Dearborn. Leslie, what's your question?
I'm wondering if cataract is a preempt to any type of heart problem.
If they're connected, I guess she's asking, or precursor to heart
Yeah,
disease.
well, good question, because I think that's something people may think about. As of right now, cataract is not related, only in that it's possible that like diabetics and people with insulin resistance may have a higher incidence, but that's, I'll say, very loose. But right now, cataract is not on my list of conditions associated with heart disease. This is an opportunity. Do we have another caller, Siobhan?
No, not at the moment.
Okay, all right, so I can rant a little bit or talk. So there are other conditions that are related to heart disease that you wouldn't necessarily think about. One of them is kidney stones, gallstones, other inflammatory autoimmune diseases like lupus or rheumatoid arthritis. And of course, you may not know, listeners, but psoriatic arthritis, this is psoriasis with inflammatory arthritis, has been pretty well established as being connected to heart disease. So there are some inflammatory conditions that relate to heart disease that I would say on a lesser level than the other conditions we talk about regularly, such as oral health, sleep health, gut health, insulin resistance, hormone imbalance. To me, those are bigger issues. Do you want to jump in before I keep talking?
No, I mean, it's very informative. I mean, people need to know. I mean, they want to connect the dots. And this, as you're talking, I'm thinking about the compartmentalization of medicine, which I think is another problem, that you go to see your PCP, you get somewhere around 5 minutes, and that's to fix what's broken today. You're in for a cough or a cold. I mean, Siobhan will tell you, you just recently had, an inflammation, and then it's just a matter of, okay, let's solve this problem today, and nobody's telling you about what's the next step in your care. And I think that, coming back to the compartmentalization of medicine, it's like the doctor sends you off to the cardiologist and off to the endocrinologist and off to the rheumatologist, and they're not connecting the dots. And these people are just going out to see and, getting tests here and there and maybe getting medications here and there. And they're basically not making any sense out of it because it's not floating down to one responsible person. Your practice is you are that overarching principle of being responsible for all of connecting all of the dots.
Well, I thought this is also a chance to just talk about some people with these inflammatory diseases. They have conditions that generate inflammation that don't present as artery disease. So yes, I use artery disease because I've got objective markers and whether it's imaging or labs, but I have patients who don't have plaque, but they have drivers of disease like gut health issues, and they have autoimmune conditions. And I've had success putting them on the right kind of lifestyle for what they have, using some other treatment modalities that we use in the office. I'm not going to talk about on the air because they are considered experimental. And I've been able to treat people with ulcerative colitis, without using immunosuppressants, people with vasculitis, and lupus. And so it's not a lot of patients because I don't have a large practice, but I've had enough success that I feel that there's opportunities to get rid of these autoimmune conditions without these potent immunosuppressant drugs that have major side effects. Infections, tuberculosis, fungal infections, cancer. We know people that have died from cancer as a complication of their immunosuppressant.
Wow, that's scary. That's it's unbelievable. I mean, but most people just don't understand how this all works. Most people don't understand how do I get plaque? And I think that most people don't understand what inflammation is all about, or how these systems play into one another. And you've got to be in a practice that's heavily, invested in serious diagnostic time to find out, because everybody's profile is different.
And well, you got to like you said, you got to make these connections. You have to look for opportunities for what people are telling you to make these connections, and they've got to be willing to hear you. And so that takes time. So that's one of the benefits of being in a concierge practice, where I'm not on a 5-minute clock or 7-minute clock. I can spend an hour, hour and a half with people and just reinforcing these messages and the proper behaviors. And then hopefully they'd be willing to kind of jump in the deep end with some of these other experimental therapies that we use. And again, we're not going to mention them on the air because we don't need the FDA shutting down my pharmacies.
Right, absolutely. And once again, with all your patients that had COVID, you treated them and none of them died. None of them went into the hospital, and that was significant proof that people need to get on that journey of joining up with a practice like yours, where you are looking at the whole person and looking at these diagnostic tests that are just not being recommended out there. Well, in the meantime, we'll have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR.
All right, so we're back on Facebook Live again.
And yeah, it's interesting, but I mean, it's just getting that concept understood by people. I mean, it's like, I still think people don't understand what inflammation is. And I think people all have the same question: is how did I get plaque? Who gets plaque and who doesn't get plaque? And like you said, you have people that don't have plaque, but they still have major problems, even although they don't have plaque. So it's like,
Well,
how does anybody?
that's why, I mean, we just talked about this on the air, but I mean, they just got to be screened.
Right.
You can't predict based on any measurement that you think that you're measuring. You've just got to screen those people.
Mm-hmm.
What other
That
type of screenings exist for inflammation? Let's say you have a clear CIMT and you don't have plaque. Does that mean you don't have inflammation, or are there other tests that might indicate that you have it somewhere else?
for brain health, and I don't do this because it's just too cumbersome and I don't have somebody to do it with, but you could do MRI with volumetrics. So whereas the CIMT is looking at plaque, the MRI would identify regions of the brain that are shrinking that correlate to different diseases. And you could possibly get a feeling in order that, okay, this person's at risk for Alzheimer's or Parkinson's based on the decrease in volume in the areas of the brain that are related to those conditions. And then, we do that cognitive view as a functional brain health test. So, whereas the CIMT is a measurement consistent with the MRI with volumetrics, and then the labs are functional in the brain, it's the cognitive view is functional. That's how I look at that. But there's no way to screen for autoimmune disease. People just have the symptoms.
Mm-hmm.
So, yeah, you don't do labs. Autoimmune diseases are diagnosed clinically. So they have, they come in, they look like it, and then you go do testing to confirm your suspicion, whether it's autoimmune tests or X-rays or MRIs. So then once you made the diagnosis, you can address it. Now, it doesn't mean that had we found this person earlier before the conditions developed, found some other inflammatory process and put them on, or just said, hey, just eat healthier anyway, maybe they would have not had autoimmune disease. I don't know.
Hmm.
But
So you were talking about the MRI with volumetrics, and I mean, since I think a lot of people are worried about, dementia and Alzheimer's and not wanting to, wanting to know whether they're at risk for that. Why? I mean, you have it done at the hospital. How many people are you sending out
I'm not
for?
sending at all.
You're not sending at all.
I don't know what I'm waiting for. I just don't know that I'm prepared to deal with the results and people getting them and they'll order. And, I would just want some cash vendor to do it. I just haven't gone looking for the vendor,
Mhm.
where to send them, what results am I getting? Is it going to be like research ready results that's like technically done? I just haven't gone there yet.
Mhm.
And I don't know that I will, because that's it's hard enough just to get patients to do a CIMT, let alone an
Yeah, it's a little more
MRI.
invasive,
Yeah, well, it's
somewhat.
more
Yeah.
expensive. Like, I'm not in control of the pricing or who's doing it. It's too much out of my control.
Got it. What do you want to come back to? Inflammation?
Sure.
Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Dr. Colliner, you've talked about this a lot on the shows, and we were discussing it on the break. Inflammation is something that people really don't understand. It just sounds like something that's out there. How do you know who gets it? Who are the most susceptible people? And should everybody be getting, is there a test for it?
Well, inflammation is a general term for how your body responds to injury. And so the process of healing is inflammatory in nature. So all of these conditions that we talk about that are drivers of disease are also creating an injury to your system in some way. And because they are subclinical, meaning, on a microscopic level, you don't have symptoms of them, so you don't know to change your behavior to stop the injury. So, people live with insulin resistance for decades before they become diabetic. Well, you have no idea unless you do that test, you actually become diabetic.
Mm-hmm.
Same with sleep apnea. I mean, you may just go, well, I'm tired and I work hard and I don't get a good night's sleep, and whatever excuse you may have in your brain that you should be tired. Not getting oxygen in your blood while you're sleeping is an injury to your body. So, having bad lipids, having too much sugar, high blood pressure, metals from soil, chemical injury to the soil, you're getting it in the food, pesticides, chemicals that are preservatives, all of those things are not supposed to be in your body. They cause an injury and they don't present themselves for decades. So finding them as early as possible and stopping the injury and healing them is how to prevent chronic disease. So somebody I read coined this term, the universal theory of inflammation, which is inflammation causes all of these different diseases. And what determines the presentation? Like, why does one person have lupus and another person have Parkinson's and another person have dementia? Depends on that person, their predisposition based on their epigenetics and their personal environmental exposure.
Mm-hmm.
And, this is why COVID made a lot of sense to me. Why does one person have lung problems and another person have kidney problems and another person have brain problems? It's the same concept. COVID was just another inflammatory source that caused injury, and different people responded differently. Now, there may be a little more scientific reasoning behind this, but for me, that's enough. You know, there might be, all right, there's a chemical breakdown of why this happened in this organ, not in that organ. Great. That doesn't help an individual that much. You know, why does science want to go and look in that direction is because they're trying to create an opportunity for a pharmaceutical that you have to buy.
Right.
When a lot of those people will just respond to appropriate lifestyle changes.
Now, coming back to insulin resistance, because there are so many people in this country that have chronic diabetes, and certainly there are a lot of children who are becoming pre-diabetic and become, get filled with diabetes. So, is there a test for insulin resistance? Should people be asking their doctor to be tested so that they don't get diabetes? Is it preventable?
Well, when you identify insulin resistance, the action is to change your lifestyle, recognizing that insulin resistance is a failure of your insulin receptor, so that when you eat something that is starchy or has sugar in it, your pancreas wants to make insulin as a signal to your organs to pick up the sugar in your blood that you just ate. And if those receptors are not working, then you have too much sugar in your body. And even though they're not getting in the organs, there's still so much sugar that they get in anyway. Your muscles and liver down-regulate the receptors. So not only do you have poorly functioning receptors, but you have fewer of them. So, the more people understand this is the process of diabetes and how do you get rid of it, well, it's don't eat sugar because you don't metabolize it, and use your muscles because muscles can absorb sugar without needing insulin. And it's so simple. That's it.
But it also takes time, and the problem with population medicine and going to see your doctor and even getting your yearly physical is you're not getting this information. The information is not being disseminated by the PCP to the patient population.
And it's a shame because how long did it take me to describe it just then and tell you what to do?
Right.
Now, you might need to hear it 25 more times before it sinks in and you start to subconsciously make better choices. But because you might need someone to walk through your day of eating, which is what I do. All right, what do you eat for lunch? What do you eat for breakfast? What do you eat for dinner? What do you snack on? When are you working out? And, I might spend 15 minutes on that. And then,
But let me ask you, not to
Yeah.
interrupt you, but you said sometimes it can take years or decades for, inflammation or insulin resistance to present. So, and, what can you do if you don't know that it's developing? Like, how would you understand that
well,
that's something
you've
that you're on
got
the path to?
Well, you got to get the blood work. So, the things that you already get can give you a sign, like your triglyceride to HDL ratio. So you all get a standard lipid panel, and if your triglyceride to HDL ratio is over 2, you may have insulin resistance. I mean, that's what I use to diagnose it. If your non-HDL cholesterol is high, and that is a measure of all your bad lipids, then you may have insulin resistance. But I also do a lot of labs that you guys don't do, which are particle numbers, because how many particles you have of one type of particle, so you all hear about LDL cholesterol, HDL cholesterol, triglycerides. The cholesterol is the same in all of these particles. What makes it good or bad is the particle that's carrying it. So particle number is a better gauge of risk than the actual amount of cholesterol. And no shock, that's not what our government does. They have a formula that leads you to a pharmaceutical product that's the whole system. So I'm not saying that that's not what I don't use those products also, but I use them differently in a way that makes a lot more sense. So identifying insulin resistance, another thing is for listeners, if you've got a family history of diabetes, assume you have insulin resistance. It doesn't hurt to eat healthier by accident or if you don't need to. But if you've got a family history of diabetes, no matter what your doctor has said, just assume you're diabetic and you have to act that way. Can't hurt.
So it can be stopped, though, the progress of becoming a diabetic if they got into a practice like
You
yours.
slow it down. It's a predisposition. You got to slow it down. If you can put it back 20 years, that's your whole life.
Right, exactly. You're buying time. Absolutely. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. Don't forget to call 866 Kolender for his offer for the free CIMT. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks also to my co-host, Siobhan Cronin. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.
Thank you.